Hi, I'm Kirsten Gagne, the CEO of Kati Collective. Kati Collective has been working with the Data Action Strategic Working Group for over a year now and has been facilitating this work to help with the creation of the IA2030 Data Action Framework. We're excited to have the opportunity to present this to you today, and we hope that you'll stay on and see ways that you can be involved in this work going forward. This data action framework was really built on the belief that there needed to be a more detailed framework and set of actions that could really help support the use of data to underpin and achieve the core principles of the IA2030. This work was created by a group of data for immunization experts who have been working on this for over a year and a half now. These folks are at the global, national, and we've also had input from the subnational level. People that were engaged in this group came from a variety of organizations, including the WHO, UNICEF, CDC, the Bill and Melinda Gates Foundation, PATH, JSI, Village Reach, CASIS, and CHI, as well as others. This work will help enable the data-guided delivery of the IA2030 strategy. The idea is that this can help reduce the amount of time that is spent on annual planning cycles and streamline yearly discussions for data-related strategic investments. This work is meant to support the development of an overall ecosystem-wide work plan that has priorities and timing aligned with funding cycles that will support countries in adopting and implementing these recommendations. This work was based on a theory of change that has been within the data for immunization ecosystem for some time. This is the data theory of change. The idea is that this set of actions, the actions around assessment and improvement planning, governance, people, tools, and evidence, if these actions happen, that can help make data be available in the right place at the right time. And it can also help ensure that data is fit for purpose, complete, timely, representative, and precise enough for whatever the intended use is. Therefore, that kind of use and availability of data will help improve decision-making at all levels, including planning, implementation, and monitoring, and ultimately result in better program outcomes, including increasing coverage and equity efficiency and decreasing overall morbidity and mortality. Using that data theory of change as a basis, our group came up with an additional theory of action. This group believes that if global, national, and subnational level immunization stakeholders are equipped with a comprehensive set of data actions to implement for assessment and improving planning, governance, people, tools, and evidence, so those boxes of actions that are part of the theory of change, then ownership can ultimately be nurtured, which can happen through global alignment with a global accountability framework. Partners can participate in annual planning and iteration cycles, which is part of what this group is developing moving forward as a part of the IA2030 Secretariat. And ultimately, data systems will be transformed or strengthened and expanded in order to deliver on the IA2030 impact goals. So the way that we intend to achieve this theory of action is through this data action framework, which has recently been published on the IA2030 website. The data action framework is comprised of a set of actions that correspond to each of the 7 strategic priorities of the IA2030 and have actually even then been mapped to the sub-objectives for each of those priority areas. The actions have been identified at the global, national, and subnational level. As the global level actions were identified, we then worked with country level stakeholders to understand what were the logical actions that countries needed to take, and then what needed to happen at the subnational level. And again, we had input from a variety of stakeholders throughout this process to really validate and ensure that these actions made sense across all of the levels. Then the actions have been segmented into transformational Transformational actions are those that were identified as being kind of game changers for data for immunization, the things that really need to be doubled down and invested in to really help make exponential change. The group also identified that a lot of great work is already happening that needs to continue to be invested in and needs to be expanded. The framework is further detailed in the full document. This document explains the process, and it talks about what's happening on an ongoing basis with the IA2030 Secretariat and how this work will be a living body of work. It also provides all of the actions that were developed, all of the transformational, all of the strengthen and expand at each of those levels, global, national, and subnational. The document is publicly available. There is a link to it just a little bit later in this presentation, but you can also go to the IA2030 website and click on the resources tab. The data action framework is available there. This framework is not meant to be a static framework. It will continue to iterate through the processes that will be developed through the IA2030 Secretariat. And that's what I'll go into next. So the next steps for this work is to continue alignment with the IA2030 Secretariat as it's being set up. This group has already created a terms of references and key milestones that have been submitted to the Secretariat. It is now included in the overall Secretariat structure and will align with each one of the strategic priority area working groups. The group then will go through a process of creating 3-year cycle set of priorities. This first 3-year cycle set of priorities will be developed in a meeting that I'll talk about in a moment. From there, we'll develop near, mid, and long-term targets for those transformational actions that are prioritized, and then work with global stakeholders to socialize and integrate the work within their annual planning processes to ensure that the prioritized data actions are actually integrated with those global stakeholders that are resourcing this work. And that's already happening with an upcoming Gavi submission with the WHO and UNICEF, where there's a mapping that's going to happen to make sure that that submission aligns with the prioritized data actions. The global community is really behind this and wanting to make sure that there is alignment in resourcing these actions moving forward. At the end of 2021, this working group will be handing over all of this work to the leadership of the WHO and the IA2030 Secretariat. So we'd like to invite you to be a part of this work. The set of meetings that we'll be having to set up this initial set of 3-year priorities based on that data action framework is a set of 4 meetings that we'll be hosting remotely. Each meeting will be 90 minutes long, and one meeting will be building on the other. So we request that if possible, if you'd like to attend, that you make yourself available to attend the entire series of 4 meetings. The dates and the times are on the screen here. We also are requesting that people RSVP to us. You can RSVP to my colleague, Brooke Cutler, brooke@katicollective.com. Please send her an email and let her know your name, the organization you work with, and that you'd like to attend these meetings, and she can send you logistical information.
We ask that people RSVP prior to October 18th.
The reason for this is that we want to ensure that the way that we plan and facilitate the meeting works with the number of participants and the types of participants we have. We also are doing quite a bit of prep work to ensure that everyone comes to the meeting well prepared and ready to really dig into the content and set the priorities that need to be set for the coming 3 years. So we'll be sending out pre-read materials for everybody who has RSVP'd. So please reach out to us and let us know if you'd like to attend. Also let us know if you have colleagues you think that we should invite, or if there's different perspectives you want to make sure are included as we move forward with setting these priorities. If you can't make the meetings, but you want to be involved in the ongoing community of practice or considered for the core membership group that will be overseeing this work in the coming 3 years, you can send Brooke an email with that same email address and just let her know what you're interested in, and we'll be sure to forward information to you as appropriate. Other ways that you can get involved, of course, as mentioned, being a part of these meetings, being a part of the ongoing community of practice, or part of the core membership group. You can also access the framework. Again, there's the direct link here on the screen, or you can just go to the IA2030 website, click on the resources tab, take a look at this framework and review and identify which actions are relevant to your organization and which ones, if you're part of a Ministry of Health and doing program planning, take a look at what actions might align with the things that are the highest priority for you. And incorporate these data actions into your own organization or country's immunization data planning and implementation cycles. Also, as you're working with global level stakeholders, make sure to draw a direct correlation between the work that you're doing and these data action principles and frameworks. Again, the global level actors are committed to making sure that activities and resources align around this framework. So the extent to which that your planning and documentation aligns with this is helpful. Thank you again for listening today. There's a lot more information that you can get by taking a look at the full document. Please send us a note if you'd like to be involved in the ongoing planning and meetings that are coming up, or if you have any questions or need clarifications about what's in that document, please feel free to let us know. Thank you.